Hi dear students, I'll now review few subjects and points about the previous lecture, and also I'll ask you a few questions and to check your understanding. So, as you know, for the inspiration of the mechanics of respiration, we have the we have the lungs here, we have the intrapleural pressure or the pleural space, and also we have atmospheric pressure. What are the factors that cause movement of air or flow of air between in and out? Of course, two forces are very important. One of them is recoil force. The recoil force is the recoil force of the lung. That's by what? By the elasticity of the lung and presence of the elastic fibers and the surface tension, of course, surface tension of the alveoli. So this is by the tissue of the lung mostly. And another force, and this one will try to recoil the lung. So the elastic fiber, its function is not just the stretching of the lung. It's also when we said elasticity means recoil after stretch. So when we said this substance is elastic, means it will recoil stretch marker. So recoil after stretch. So this is the elasticity. What about the pleural pressure? Negative intrapleural pressure. Negative intrapleural pressure is needed to cause chest expansion. And whenever we increase negative intrapleural pressure, we increase chest expansion, and if it's more than normal, it will lead to inflation. If we increase recoil pressure, and if after increase the recoil pressure, there will be decrease in the chest expansion or collapse of the lung. You can see in some question it will ask you about what is the pressure inside or which one is the highest or lowest. This pressure is in the pleura, in the alveoli, and in the mouth pressure, because this pressure are important for movement of air. If it asks you about which one is lowest, of course, if in the question say pleural pressure, if it say pleural pressure of course is the lowest one because it is negative. But if the question say negative intrapleural pressure, when it say increase in the negativity, when negativity increase, it means more expansion. Okay. But when it say which one is lowest, the pleural pressure is lowest here, except in one situation in which the pleural pressure exceeding the mouth pressure, which is in the during forceful expiration. At that time, the pleural pressure even become positive. But when it's become positive, it is still negative in regard to the alveolar pressure because it is less than the alveolar pressure. So every time the pleural pressure should be lower than the alveolar pressure.